Good morning, everyone. Today, in this surgical nursing hour, we will be dealing with BPH. We can call it as benign prostatic hypertrophy. Sometimes you may hear this word as benign prostatic hyperplasia. Both are same. Okay. So, from the name itself, this is one of the condition which related to prostate gland. Prostate gland, which I hope you all know what is prostate and its peculiarities, characteristics, everything. Okay, so let's go into detail. Benign prostatic hyperplasia or benign prostatic hypertrophy, both we can call it. Uh, both are same. So this is occurring when this prostate gland is increasing in size without there being any malignant cause. Without any malignant cause, the size of the prostate gland is being increasing. Usually, what happens when it enlarges, it will be compressing the bladder, urethra, and the passage of urine, and difficulty in urination will occur due to this compression. And this is the organ which is present in males, and especially when the patient is becoming according to aging, as the client's age increases, this condition worsens more and it starts to appears. Okay. And something basics about the prostate gland. It is a male sex gland, pear shape. It is having size of walnut. It helps to control the urine flow and produces the fluid component of semen and produces prostate specific antigen PSA. Hope you may know heard this word PSA, and we will be dealing detailing. And this is one of the pictures showing the bladder, urethra, the prostate where it's located. And prostate, it is a fibromuscular glandular structure which is situated between the neck of the bladder and external urethral sphincter and surrounds the prostatic urethra. It is iconical in shape. It is having three surfaces, anterior, posterior, and two inferior lateral surfaces are there. This is just to understand the basic anatomy of this prostate, so that you will be able to understand more easily regarding the management, surgery, everything. Okay, and clinical features. Then it is having five lobes, anterior lobe, posterior, median, two lateral lobes, and size. It's about 3 centimeter vertically, 4 centimeter transversely at the base, and about 2 centimeter anteropod. Nothing to be more study on this point. This is just to brush up your anatomy classes. Okay. Then physiology. We all know it is a male sex gland, and it will be secreting glycol proteinaceous fluid which is known as PSA, prostate specific antigen, and it will be liquefying the semen and allow the sperm to swim freely. This is the basic function of the prostate gland, and also it will be controlling the urine semen flow. A flow of both urine as well as semen will be controlled by this prostate gland. And the secretions or the prostatic fluid which is secreting is slightly acidic, and it will be forming about 20% of the semen volume. And some of the more points are there, you can read later. Then levels of prostate specific antigen normally in a male. In a normal male, the normal level of this PSA is 4 to 8 nanomole per ml. But in case of BPH, it will be 9 to 10. Less than 4, this is a suggestive of cancer. That is CA of prostate gland. And more than 10 also a suggestive of CA prostate. Okay. Now let's coming to our condition, that is what is benign prostatic hyperplasia. For your better understanding, I have added three definitions, and the easier one you can study. Okay, so the first one, from this picture itself, it is very easy to understand what is basically this BPH. There is no need of further explanations and all, I hope. So the first definition, common disease in aging men, a non-cancerous enlargement or the hypertrophy of the prostate gland. That is the definition. Non-cancerous enlargement or hypertrophy of the prostate gland is known as BPH. Then it explains what will be happening after this enlargement. That is, when the prostate enlarges, it can squeeze down on urethra and slows or impede the flow of urine. Okay, so the basic definition is this part, non-cancerous enlargement or hypertrophy of the prostate gland. Okay. This is the one which is enlarged. Okay. Now another a definition: enlargement of portion of prostate enlarges, extending upward into the bladder, obstructing the outflow of urine. This is another definition. And one more definition, which is comparatively more little bit larger one, but easy to understand, because it is a non-cancerous increase in size of the prostate gland involve hyperplasia of the prostatic stromal and epithelial cells, resulting in formation of large fairly discrete nodules in transitional zone of prostate, and it pushed on and narrow the urethra, resulting in an increased resistance to flow of urine from the bladder. This is it. Sorry, it's a spelling mistake. It is it. Okay. So for more easy understanding, if possible, you can study by this thing. It is a non-cancerous increase in size of the prostate gland that involves hyperplasia of prostatic stromal and epithelial cells. Enlargement is being occurring, non-cancerous size increasing size occurring due to hyperplasia of prostatic stromal and epithelial cells. And what will be the result? It will be resulting in formation of large, fairly discrete nodules in transition zone of the prostate. And then what will happen? It will be pushing and narrow the urethra and result in increasing the resistance to flow of urine from the bladder. So it's somewhat a little bigger, but according to mark, whenever needed, you can add this definition also, because BPH is one of the most important questions being asking for your examination. That's why I have added these three definitions. Okay. Non-cancerous increase in size, hyperplasia of prostatic stromal and epithelial cells, resulting in formation of nodules in the transitional zone, push down and narrow the urethra, resulting in increased resistance to flow of urine. Okay. This is again a picture just to understand normal prostate and large prostate, what is being happening. Okay, now let's come to the etiology and risk factors. Basically, the exact cause is unknown. It occurs due to multiple risk factors, like there are hormonal factors, excess dihydrotestosterone level, aging, diet, lifestyle, hereditary, race, ethnicity, comorbidities such as DM, cardiac diseases, certain drugs such as alpha adrenergic agonist, smoking, alcohol, obesity. So let's move on to each point's detail. So hormonal factors like testicular, the increased level of testicular androgens, excessive stimulation of estrogen, excessive prostatic antigen, that will contribute to BPH. And frequent use of alpha adrenergic agonist, that is, it is kind of drug that will be over-the-counter cold medications. Along with that, the diet pills will be increasing the severity of BPH. And something regarding the diet with a high amount of animal fat, saturated fatty acids, and also along with lack of exercise, that also increases the risk. Then smoking and alcohol. Some studies have shown that the smoking and alcohol is increasing the risk for BPH. Also, the increasing BMI, that is obese condition, that is also another risk factor for BPH. Okay. Then aging, as we all know, as the age increases, this prostate gland enlargement will be occurring. And after younger than 40 years, if a male is of younger than 40, the signs and symptoms is very less, and it may not be appear. But about one third of the men experience moderate to severe symptoms by age of 60. Okay, and more symptoms will occur after age of 80. Then something regarding the family history. Having a blood relative such as father or brother with prostate problems, that's first degree relatives have the higher chance. Then ethnic background like Asian men are having more chance. Then diabetes and heart diseases. It's some of the studies that showing diabetes and heart diseases also contributing to BPH. Then lifestyle, obesity, we have already discussed the point. Then excessive dihydrotestosterone. This is the one, it's very important. That is, it is an active form of testosterone that support the prostate growth and development throughout the life. Okay, that is dihydrotestosterone, DHT. This is the active form of testosterone which will be promoting the prostate gland growth. Okay.